Personally did not learn how to deal with grief and loss in nursing school.
Hey, I'm Meg. I've been a nurse for about 14 years now almost. And here's my advice for dealing with grief. We see the happiest moments, we see the miracles, but we also see all of the death and destruction and kind of the worst parts of humanity working in healthcare. Here's what I suggest you do. Before each shift, some sort of meditation or prayer to prepare yourself for what's coming, almost like a little protection ritual. At the end of your shift, you need to have some kind of decompression hour. So if that means sitting in your car and journaling for 15 minutes, calling someone on the way home to just talk about what happened. If you have nobody, DM me and I will absorb it. I will listen to you and you can let it out in this little community or in the comment section right here. Therapy once a month. There's lots of different options. There's apps that are less than $100 a month. Somebody to help you professionally navigate these emotions. You cannot keep it all inside. It's going to get embedded in your subconscious and will come out in unhealthy, bitter ways. So those are my suggestions for dealing with grief and loss.